name is Dr. Keough. I am a child neurologist here in Austin, and I work with a private practice called Child Neurology Consultants of Austin. In addition to that, I serve as the Chief Medical Officer for Compassionate Cultivation and have been affiliated with them since we first placed the application to become one of the licensed dispensaries here in the state of Texas. I'm here today to present some information about CBD in the treatment of epilepsy, which was the first state-sanctioned diagnosis for using medical cannabis in the state of Texas. And we're going to go through quite a bit of information. I just wanted to say hello before we get started on the slideshow presentation. That will probably take a little over half an hour to get through, and after that, we'll be open for questions. So if you have questions, please send them in to us, and I am happy to address them when we're finished with the slides, and I welcome your questions, so please send them in. I'm going to share the screen here and then go full screen so that we can see that. Let's see. And there we are. So first we're going to talk a little bit about the dispensary itself, Compassionate Cultivation, and then go into the history of the Texas Compassionate Use Program, the basics of CBD treatment, focusing on epilepsy therapy. Then we'll talk a little bit about the expansion of the Texas Compassionate Use Program, which we affectionately call the Teacup, and how that has changed in the past year after the legislative session in 2019. We'll go through some scientific evidence about the approach to CBD and THC therapy, and there is a lot of ground to cover in that realm, so I'm really going to focus on a pretty narrow area, mostly focusing on epilepsy, and talk a little bit beyond epilepsy about other symptoms that CBD and THC can treat. And then we'll talk on some other topics briefly, touch on terpenes, THC itself as a part of the therapy, institutional policy and the challenges in having this medicine administered in hospital settings, in schools and things like that, and a few other things on the horizon that we think about here at the dispensary on a daily basis. So this is Compassionate Cultivation. It's we also call the Texas Original Cannabis Company, and it's the only licensed medical cannabis producer that is headquartered in Texas and has been open for several years and started dispensing medication in early 2018. So this is a little bit about the values and the mission of the company. And it's a hardworking group of people that I'm very, very honored to be affiliated with. They're doing a fabulous job. And incidentally, in the era of the pandemic, I think that some of the patients had been nervous that there could be disruption to their supply of medication. And the dispensary staff has gone to extenuating length to make sure that there is no interruption, and they've had no difficulty in meeting that demand and making sure that everyone is able to get their medication. So here are some pictures from the dispensary itself. It's a one-stop shop. Everything having to do with the production of the medicine is actually housed within the warehouse, which is in Manchac, Texas. So you see the plants on the left, those are actual cannabis plants. They're growing at the dispensary site. And the middle picture is a picture of the extraction machine that actually produces the medication and distills the oil that's enriched in just the right chemicals. And then that is further processed into a medicinal compound that you can take as a medication. And all of the people pictured here are actual dispensary staff members. So the history of the Texas Compassionate Use Program goes all the way back to 2015. And it was really a groundbreaking deal when this was brought forward through the Texas House and signed and enacted by the governor at the time to allow the production of medical cannabis in Texas through some state licensed and state governed dispensaries. The first license that was awarded, or the license that was awarded to our dispensary, came through in October of 2017 through a competitive process where many different companies applied to get a license, and 3 licenses were granted. Compassionate Cultivation earned a license in October 2017, and the first physician registered to prescribe medical cannabis was approved by the Texas Department of Public Safety in November of 2017. And then 3 months after that, we actually dispensed the first prescribed medication through the Compassionate Use Program. In June of 2019, Chapter 2 of the Texas Compassionate Use Program was enacted, and we'll talk a little bit more later on about how that has changed the program and what else is possible now for medical cannabis therapy in Texas. So as a patient, and I think most people watching today are probably patients, but probably some prescribers out there as well, but this is more focused towards the patients who might be watching. As a patient, if you're interested in exploring medical cannabis as a therapy, your first step is to talk to your physician and to explain why you're interested in trying that, and then look for a prescriber who is registered through the Compassionate Use Registry Program in order to obtain a prescription. So Texas is very unique. Most states do not require doctors to be involved directly in obtaining the medication. So in some states, the physicians are there to certify patients as eligible to obtain medical cannabis, but actually guiding the therapy, writing prescriptions is not something that most states require. So I personally think that that's the right way to do this. This is a medication, and it has a lot of implications for medical therapy. It has interactions with other medicines. And by all means, using this medication should be something that you do as a partnership with a treating physician. So I'm very pleased to be living in a state where people recognize the importance of physician involvement. And that's why I was one of the first physicians who was registered to participate in compassionate use. So you have to obtain a prescription. It's not like a prescription that goes to your regular pharmacy. It actually goes into the Compassionate Use Registry, which is an online registry, but it has a lot of the same information that you would have in any other prescription that you might take for other medical conditions. That online registry is accessed from the dispensary side by using the same identifying information that you provide to the physician, but it's very protected, it's completely private, and the only people who have access to that are the dispensary staff who fill the prescription and the doctor's office who places the prescription. So in that way, it's similar to a regular pharmacy prescription, but it's a completely internal, unsecured and secure system. So the next step would be for the patient to call the dispensary and let them know that the prescription is there for them to fill. The dispensary cannot see that prescription just pop up on a screen. You actually have to call the dispensary and give them identifying information so they can locate the prescription in the registry. Without that information, they actually won't know that a prescription is waiting for you. So the patients have to communicate with the dispensary staff, and then the dispensary staff will fill the prescription according to the directions. And patients can either pick up that prescription by driving directly to the dispensary, which is still open today with lots of precautions for infection prevention. And you can pick it up yourself, or you can actually have the medication delivered. So one of the requirements through the Compassionate Use Program is that every single prescription has to be hand delivered if the patient is not able to pick it up. And that includes the entire state of Texas, all the way from East Texas at the border of Louisiana to El Paso to Brownsville, everywhere. So the drivers who work for Compassionate Cultivation hand carry and deliver these packages for prescription and give them directly to the patients or a patient's representative who is specifically identified in the CURT registry as eligible for picking up the medicine. And that is the whole process. The next step would then be to follow up with the prescribing physician to make sure that the medicine is working the way that you want it to, that you're getting the effects that you want, that you're addressing any side effects that might come out, and then have the medicine adjusted so that you can get the best possible response. So why is this medication even relevant and something that's important to medical therapy today? Well, it turns out that in everyone's bodies, on a very, very microscopic level, there are actually receptors that interact with chemicals that come from the cannabis plant. And this is not unique. There are chemicals called endorphins, which are receptors that stimulate receptors for opiates. So opiates are strong pain-killing medicines that are in the news a lot these days. And we have receptors for those that are called endorphin receptors. So there are endocannabinoid receptors. It's a very kind of analogous situation. So there are two different receptors that have been discovered, and they occur in lots of different tissues throughout the body. So the brain is especially rich in cannabinoid receptors, but there are actually multiple other tissues that have receptors. And in particular, the immune system has very rich receptors, but also the liver, the bones, the muscles, the reproductive organs. It's really all over the place. So we think that there's probably a lot more to the endocannabinoid system and the possible medical applications for these chemicals that are still to be discovered as we learn more about how we could use these important medicines. So we're going to shift a little bit and talk about how epilepsy is related to, and I'm going to put this up so you can see my slide a little bit better, how epilepsy is related to medical cannabis therapy. So in 2015, as I told you before, that's when the compassionate use program was first approved in Texas. And originally, the only eligible diagnosis was epilepsy, and specifically something called refractory epilepsy. And what refractory epilepsy means is that you've tried some medicines, and even though your seizures might be better, you're actually still having seizures even though you're taking medication. So it turns out that this is an especially good condition in response to cannabis therapy. But in 2015, when the compassionate use program first came out, that was still a very controversial idea. And there were some studies that were ongoing to explore and understand whether or not that medicine would whether or not these medicines would really be effective for epilepsy, but they actually hadn't been published yet. So in 2018, this is when the first conclusive trial was published, and this was several years after Texas had approved the compassionate use program for refractory epilepsy. So it turns out that Texas did a really good job choosing something that science was about to break through and really prove to be a very worthwhile and important way to treat epilepsy. So a phase 3 study is a study that is performed on human patients, not mice like the little picture, but actually in human patients. And it's also done as a design where you're comparing patients in one group who are getting treatment with another group who are not getting that treatment. Now, all of these patients, because they had epilepsy, they were taking other medications for epilepsy at the time, lots of other medications, but they were either given additional treatment with CBD, cannabidiol, or they were not given any additional treatment, and then they were compared. So they studied a special kind of epilepsy. It's called Lennox Gastaut syndrome, named for two different French doctors who described this a long time ago. And they looked at how it affected a special kind of seizure that's called a drop seizure. A drop seizure is when you have a seizure and you suddenly fall to the floor. You're completely unable to protect yourself. So needless to say, that can cause lots of injuries. It can cause head injuries and broken bones and chipped teeth and other kinds of serious injuries when you have a drop seizure. And drop seizures occur very commonly in this particular kind of epilepsy, Lennox Gastaut. So what they learned is that when they added this new medication, CBD, cannabidiol, to the other medicines the patients were taking previously, they had a marked reduction in drop seizures. They went down by 2 to 2.5 times fewer seizures when they added cannabidiol. They also learned a lot about drug interactions in this trial, and they learned about what kinds of side effects they might see. And they learned, which is true in virtually every drug that you can imagine, the higher dose that you take, the more likely you are to have some side effects. And these studies are really important to understand what to expect from a side effect standpoint. So there were lots of different ways that they looked at this, and there was actually a second trial that was also published separately. That study also showed that there was a reduction in drop seizures. They measured it differently. They said how many patients had a reduction by half. If they had, say, 15 seizures a week, they had to drop to 7 or fewer drop seizures a week. And that occurred in 39% of patients who were taking a high dose, and in 36% of patients who were taking a moderate dose, but only occurred in 14% of patients who were taking placebo. And then even better than that was a 75% reduction. So if you were having 9 seizures a week, you had to go down to 3 seizures a week. and they're measuring over multiple weeks. So that also occurred, and it was more likely to occur in the high dose group. And then there was a small group in the study who actually completely stopped having drop seizures. That's a very important group because that's what we would really ideally like to have happen in any new medicine that we try. We really want seizure freedom. Now we know with this particular kind of epilepsy, that's a very difficult goal to achieve, and a lot of patients won't achieve seizure freedom. But to get 5% of them to stop having drop seizures entirely, that was a big deal. And that has been something that runs through multiple trials for cannabidiol, that there seems to be a small group of patients with epilepsy where CBD is the best thing that's ever happened to them. Their seizures really respond better than other kinds of seizure medication. So these breakthrough studies led to the approval of cannabidiol by the FDA. But even before that medicine came out, CBD and THC were available through the Compassionate Use Act and have been used really across the country, because almost every state by that point had medical cannabis available for treating patients, and lots of people were starting to use this medication for epilepsy. So what I'm going to share with you next is a summary of a lot of patients that I have personally treated in my own practice. Every patient that I have looked at in this study has consented to have me reviewing their records and sharing these results in an anonymous way. So this is not something that would be identifiable on a personal level, but the patients are well aware that we have been watching their response, and they're excited to be able to share this great response. So I am up to over 100 patients, and this study looked at 135 patients, and I totally reviewed this and updated it around February of this year, just at the end of January, early February. So some of these patients have been taking dispensary CBD for almost 2 years by that point. So this is a cumulative response, meaning that this isn't just the first month or two that they were taking medication. Some of them have been taking it for 6 months, some for a year, some of them have been taking it for 2 years, nearly 2 years at the time that all of this was summarized. So the very best responder group was the green slab of pie at the top that I call super responders. And that was 16% of the 135 patients that had a sustained reduction in seizures where they had greater than 90% reduction. So that is a very, very powerful number. That's a lot of people who have tried a lot of other medications and their seizures did not get better. And when they added CBD in, they actually had a 90% reduction. And then I had another group, exactly the same size, of 16% high responders, where they were between 50 and 90% of their baseline rate of seizures. So like we were talking about before, if they were having, say, 20 seizures a month, they would have to drop to at most 10 seizures a month. That would be 50% reduction. 90% reduction would be going from 20 seizures a month all the way down to 2 seizures a month. So that would be a 90% reduction. So between those two, we get to almost a third of the patients that I've treated who have had their seizures cut in half or better, okay? Now, an important thing to keep in mind is that most of my patients still do take other medications besides Lone Star CBD, okay? And that's important because I think a lot of people think even if you're a really, really great super responder that you will be able to stop all of your other medications. That is actually pretty rare, although over time I've had more and more patients who are doing exceptionally well and I've been able to peel back some of their medications. At the time that I did this review of 135 patients, I only had 4 patients who had been able to stop all of their other seizure medications. That might have been 1 or 2 or 3 other medications. I had 4 that had gone down to what we call monotherapy and were only taking Lone Star CBD, or if they had insurance approval, some of them at that point were taking Epidiolex. And we'll get to Epidiolex and Lone Star CBD a little bit more in the next slide. So those are the most impressive kinds of responses. But in addition to that 1/3 group where we had a very promising and worthwhile decrease in seizures, I had another group of patients who really felt that their seizures improved, even though it wasn't a 50% reduction. So because I do epilepsy all the time, all of my patients have epilepsy. That's the entire focus of my practice. And many of them have very severe epilepsy. Many of them have a high burden of seizures. So if we can even decrease their seizures by 10 or 20 or 15, 15%, that still can be very meaningful, depending on how severe the seizures are and how frequent they are. And most importantly, it goes along with how they feel on the medication. So CBD, one of the beautiful things about it is that it tends to cause a lot fewer side effects than other kinds of seizure medications. And because of that, people like to keep taking it. They're willing to pay for it and buy it for the dispensary and go through all of that effort, because even if their seizures are not fully controlled, they feel good on this medicine, and it can actually cause some other good beneficial side effects. So a lot of the things that I hear from my patients are listed on the other side of the slide here, other reported benefits. Patients, and remember, I'm a child neurologist mostly. I have some adult patients too, but mostly I'm taking care of young children. And so this is mostly reported by their parents or caregivers. They're more alert, they're talking more, they're making developmental progress, they're sleeping better, behavior issues tend to improve, they seem to learn a little bit better, they may eat better. If eating is a problem previously, that can be better. Constipation is often better when you start CBD because of the oil-based carrier. So there's lots of things listed there. And on the other hand, fortunately, there is a very low profile for side effects. So the side effects that I hear about from Lone Star CBD are very similar to what was reported in the Cannabidiol trials. Excuse me. I just want you all to know I tested negative for COVID last week, but I do have a cough. But I'm not exposing anyone today. So the side effect profile is very good. Sometimes there is sleepiness, especially when this is a new medication. Sometimes it can cause some diarrhea or a little bit of nausea, and these things are more common at higher doses, but they're usually pretty manageable. So to get back to the pie over here, you can see that on this left side of the pie, there are some patients who did not respond as well, and we always know that this will happen. Every medicine has, some people it will help a lot, some people it will help less, and some people don't necessarily get a lot of benefit. So I had actually 19% of patients who said, I don't think that this medicine is changing my seizures very much or my child's seizures very much, but because of all these good things that I like about CBD therapy, it's worth it for me to keep using this drug, even though the seizures haven't changed. So I have seen a lot of epilepsy patients choose to keep this as a treatment for other reasons. I had about 18 patients who tried it and didn't really see benefits that they thought were worthwhile enough to continue, and they stopped the medication. And then I had a small group of seizures, and this is something that had been reported in other studies. Sometimes when we start this medication, instead of making the seizures better, sometimes the seizures actually got worse. It's a very unusual side effect. So I got that in 7%, which means about 6 patients or 7 patients. And actually in a couple of patients, we were so motivated to make sure that that wasn't just coincidental. We actually tried it more than once in a couple of patients. And it was clearly true that in some patients, it can make the seizures a little worse, but fortunately, that does not happen very often. So this is my own response table. And I think it's a really useful group to look at because it's a large group of patients who all started with the same dispensary formulation. It's a very consistent source of medicine, and a lot of studies out there that have looked at CBD therapy in other states. Patients are getting CBD from all over the place, and there's a lot of different kinds of medicines in the mix. This is a very pure sample of patients using medicine from a single dispensary. So the next slide is a subset of patients, and this is again something that I totaled up at the end of January this year. And these patients are a subgroup. Remember before I had 135 patients. In this pie graph, it's representing 75 of those same 135 patients. And so if you were in this pie graph before, then you might have moved into this pie graph if you ever were able to get insurance approval for Epidiolex, which is cannabidiol, that's the FDA approved form of CBD. And this was a group that was really important for me to look at and understand because we didn't have this kind of information before. So Epidiolex is different from the dispensary CBD because the only thing that's in Epidiolex is CBD. That's the only chemical, that's the only medication. Lone Star CBD has CBD that's just the same as Epidiolex. It comes from the same plant. It's extracted the same way. It's mixed in oil. It's given the same way, orally and absorbed. And it's targeting the same treatment, the same condition, which is epilepsy. But the difference is if you get CBD from the dispensary, in addition to getting CBD, you're also getting a very small amount of THC. So because of the law in Texas, the concentration of THC is very limited to a very low concentration, but it's a very important difference. And this pie graph talks about how important it is that Lone Star CBD and Epidiolex are not the same. They are different because of the THC content. So I have 75 patients represented here. I have more patients than that now that are not represented here, but many patients that were taking dispensary CBD, got approved for Epidiolex, and then stopped using the dispensary supply and switched to Epidiolex. So about a third, again, that 1/3 number is kind of an easy one to remember. In this case, it was actually 35%, but about a third of people, they switched over and they said, you know, this is about the same. I can't really tell much of a difference. I'm going to continue, and insurance is paying for this, and that makes it easier to afford. So they're using Epidiolex alone at the time in January. So interestingly though, I had a larger group of patients than that. So 43% of this group who went from dispensary CBD first, Lone Star CBD, and then they switched to Epidiolex, and they came back sometimes immediately. Sometimes I heard about this within days. Sometimes it took weeks, or sometimes it took even longer than that. But they came back and they said, you know what? This is okay, but it's not as good. I find that I'm seeing more seizures. I really think that we were doing better on the dispensary CBD. So in that situation, what I would do is mix back some dispensary CBD to give back the THC. And in some cases, that even happened when patients were able to take much higher doses because insurance companies paying for it. They're going to higher doses of CBD. And even the higher doses couldn't do what they were getting before when just a little bit of THC was mixed in. So this is really important data. These data have not been published previously. We don't have a study like this that looks at a group of patients who have gone from CBD plus THC to CBD alone with a single manufacturer and be able to compare those patients before and after that switch. Really powerful information. And because I learned that, I now approach it differently. And when I have a patient who gets approved for Epidiolex, if they've been using dispensary CBD, I have learned not to take away their THC. So there's now a different way that I can provide THC for them and keep them on a little bit of THC while they're taking Epidiolex. Excuse me. So, I have another group of patients in this area where they came back and they said, okay, the seizures aren't necessarily worse, but there's other things that we were getting from the dispensary CBD. And I missed that. Sometimes that was sleep or behavior. Sometimes it was just calmness. Other kinds of beneficial effects that they were getting from THC, and they lost that when they went to CBD alone. Sorry. So in some cases, we added back a little bit of a THC component from the dispensary to give them back those beneficial effects. Now, I have a few patients that had tried some dispensary CBD and then tried some Epidiolex separately. They stopped it. Most of the time because it just wasn't helping, sometimes because of side effects. Thank you very much. That's what I was looking for. A little water. And I have a small group of patients, and it's just a handful, but I think it's an important group. I have a few patients that really did not do as well on Epidiolex and went back completely to the dispensary formulation because it was working much better and they prefer to take that. It's not a large group. Most of my patients do well with a combination of both, and I'll tell you how I do that. But I've had a few patients who really just prefer the dispensary formulation entirely. So I want to tell you about one of my patients who's an especially compelling story about how CBD is sometimes the best thing ever. So this is a young patient who has what we call idiopathic focal epilepsy. That means we can't see a reason for why this epilepsy happened. When we take a picture of the brain with an MRI, it looks normal. When we do genetic testing, it looks normal. This patient also has autism and had a regression in skills and developmental capabilities. And around the age of 3.5, started having seizures. So I have a lot of abbreviations in this slide. It's not really important what it is, but those are abbreviations for 4 different seizure medications, one after another, that just kept just failing. That this patient continued to have seizures on sometimes one of these drugs, sometimes 2 or even 3 of these drugs simultaneously, still having seizures. So I brought the patient into the hospital and did a video EEG, which is where we hook up an EEG with electrodes all over the head. We run a video and we run it for more than a few hours. We run it overnight. Sometimes we'll run it several nights in a row because we want to see the seizures and understand them better. And in 24 hours, this patient had 7 seizures. So proven epilepsy, not just from a history or a story, but actually captured and proven seizures, 7 in 24 hours, failed 4 medications. So he was one of the first patients that I treated when CBD became available. This patient's mother was very motivated to try CBD. She was sure it would be the best thing they had tried. And fortunately for him, it actually was by far the best thing that he had tried. And when he was on a very low dose, 2 milligrams per kilogram per day, and just to keep in mind, I have a lot of patients that use between 10 or even 20 milligrams per kilo per day to get this kind of a result. But at 2 milligrams per kilo per day, he stopped having seizures entirely. When we first added it in, he was taking 2 other seizure medicines. So he first stopped the clonazepam, the KLP. Then he eventually, it took almost a year, but eventually he came off his other seizure medication and he was on CBD all by itself. And then we got insurance approval for Epidiolex. So he switched to that and we went up on the dose a little bit. But he has done very, very well with CBD as his only seizure medication. Last year, he had 2 seizures the whole year. This is a patient who had 7 seizures in one day, and he's now on a higher dose. So we did another video EEG, and we show that he still has some discharges. We know that he still has epilepsy, but in 24 hours this time, he didn't have any seizures at all. So we were able to prove with an EEG that the seizures were much better. So this is another story, another patient that I take care of, who started having seizures at 5 years old. And the seizures would just be the left side of the body, convulsive, so jerking. And when this patient had seizures, it would go on for a long time. We call that status epilepticus, where you have to give rescue medications to make it stop. Sometimes you have to go to the emergency room or even get admitted to the ICU. And this patient was repeatedly admitted to the hospital with very long seizures and actually went through 5 different medicines, some of them alone, some of them in combination, and still had seizures and still got admitted to the hospital. And then we put in a vagus nerve stimulator, which is a device that you can surgically implant. And that helped because the stimulation with this electricity would stop the seizures and she wasn't having to go to the hospital as much anymore. But finally in March 2018, we had the opportunity to try Lone Star CBD through the Texas Compassionate Use Act. So she was on 2 other seizure medicines at the time, valproic acid and lamotrigine. And in July of last year, after she had been on Lone Star CBD for about 16 months, she came off those 2 medicines one after another, and she takes Lone Star CBD. She still has her vagus nerve stimulator, and she only had 2 seizures last year, and both of them were self-limited. She's not been back in the hospital, and CBD is her only therapy. Her insurance company denied Epidiolex, so the only way this patient has access to this is through the Texas Compassionate Use Act, and she is taking that today, and she has done extremely well. So these are 2 wonderful examples of how this can sometimes be the best medicine that a patient has ever tried. And that's why, as someone who treats epilepsy every day, I feel it's very important that every patient has the opportunity to try this medicine when other things haven't worked, because it might be the best thing they've ever tried. It might be the answer. And I have a couple other stories that are just this good, but I would fill up a lot of slides if I told you all of those stories. So let's move on to what happened at the end of the legislative session last year. What changed? House Bill 3703 was passed in June. And one of the things that was very exciting is that they expanded the list of conditions that are eligible for medical cannabis therapy in the state of Texas. Anybody with epilepsy is now qualified. So previously, you had to have tried 2 other seizure medications first and still had seizures. But if you were taking medicines and not having seizures anymore, you couldn't try CBD. You couldn't try it to see, well, maybe it would be better than what you're taking now. Now we have the capability to prescribe it even for patients that are fully controlled, and for patients who might have only tried one medicine previously, or just are recently diagnosed. So that was one expansion. It was also expanded to include patients with autism, patients with multiple sclerosis or other causes of spasticity, which means increased muscle tone. That can come from lots of different kinds of conditions, but especially from spinal cord injuries or cerebral palsy. Those are conditions that can cause spasticity in addition to multiple sclerosis. It was approved for palliative care for patients with terminal cancer, which is widely used for that, and also for what we call neurodegenerative diseases. So one example of a neurodegenerative disease is ALS, amyotrophic lateral sclerosis. That's also known as Lou Gehrig's disease. But there are lots of other well-known diseases like Parkinson's disease, Alzheimer's disease, other kinds of dementia. These are progressive disorders. They get worse over time, and we don't have any treatment to prevent the progression of these diseases. So the Texas Department of Health and Human Services actually came out with a very, very long list of neurodegenerative diseases. And there's a web link on my slides here that are going to be available for you to review. If you are interested in looking, you can see at the whole list of everything that's included on neurodegenerative diseases for the Texas Compassionate Use Program. So there were some other things that changed, and there are nice changes because there were some cumbersome aspects to how the Compassionate Use Program works. Originally, when the first series of patients were registered, we used to have to get a second physician to approve the nomination of a patient for treatment and verify that, yes, indeed, this patient qualifies according to the law, and you as the treating physician can write the prescription. Now, the second doctor didn't have to have anything to do with writing the prescriptions, but it was an extra step, and it was pretty challenging. For me, in my practice, I have several partners who work in the same office that I do, and they can look through it and they could be my second person. But people who worked in other places where they didn't have a partner who could do that, they had to send records for other people to review. And I served as a second medical opinion for a lot of other physicians to be able to approve their patients. And that was hard. We don't have to do that anymore, and that's really lucky. They also removed the requirement to have the physician's names published. They could be anonymous, and they didn't necessarily have to be on a list anymore. Some of the prescribers preferred that, although personally I like for people to know that I'm available to write prescriptions for treatment if they want. But the other thing that they did, because again, and this was at the request of prescribers, is they changed the word prescribe and clarified that really what they're asking is for the physician to enter information into the CURT database about treatment. And some of the physicians were a little concerned about writing a prescription legally, because this is still considered to be a federally illegal substance, even though it's legal in the state of Texas. So this was meant to make the prescribers more comfortable with the process of being involved in the CURT registry. So probably the most important thing was that it removed the required minimum concentration of CBD. So in the original law, and we didn't talk about this before, but we'll talk about it now because it's getting into the section where it's very important for the next few slides. Originally, not only was the amount of THC limited to a low concentration, so it has to be lower, it can be as high as 5 milligrams per milliliter, or it can be lower than that. At the dispensary of Compassionate Cultivation, all of the products that are made have the same concentration of THC, which makes it easy to keep track, it's always 5 milligrams per milliliter. That's the legal limit. Okay. Originally, the CBD requirement had to be 20 times higher than that. So the CBD had to be 100 milligrams per milliliter. So you could make the THC go lower, but you couldn't make the CBD higher and you couldn't make the CBD lower. And they changed that rule. And that is super important. And the next few slides are going to explain why that's important, because sometimes, depending on what you're treating in a patient, sometimes it's better to have the amount of CBD and THC a little closer to each other. So CBD, it takes actually a lot of CBD to get a medicinal effect from it. For it to do what you want, you need pretty high doses. You only need a smidge, a very small amount of THC to get a benefit from it. But together, depending on what you're trying to treat, you might want the CBD to be relatively lower. And as of last June, we started to be able to offer different kinds of mixtures where the THC was always still at 5 milligrams per milliliter, but now it could be as high as 100 milligrams per milliliter, but sometimes it's lower. So at the dispensary at Compassionate Cultivation, they now make 2 other forms. One is what we call a 3-to-1 ratio. So compared to the 5 milligrams per milliliter, the CBD is at 15. And then they have a 1-to-1 ratio where the CBD and the THC have the same concentration of 5 milligrams per milliliter. So this has been something new for me to get used to as a physician. I've never used a medication where ratio was an important part of thinking about how to prescribe it and how to decide which formulation to use. But now that I've gotten used to it and understand it a lot better, it gives me a lot of flexibility to treat different symptoms in different patients and really tailor the treatment to what they need. So this is a picture of the actual medicines that come from Compassionate Cultivation, and you can see in the numbers here across the middle. To the left in the red is the 20-to-1, that's the original formulation, very high CBD, 100 mg per mil. The middle in the green is the 3-to-1 formulation, 15 milligrams per milliliter of CBD. And on the right is the 1-to-1, which is 5 milligrams per milliliter of CBD. And in every single bottle, the concentration of THC is the same. What's different is the CBD. The reason there are 6 bottles and not just 3 bottles is because there are CBD pure and CBD plus varieties for each of these different mixtures. There's another slide about that, so we're going to return to that in a few minutes, and I'll explain to you why. This is one other bottle. This is another product that comes from Compassionate Cultivation. It is a spray formulation. This is not an oil. You can give this to patients, or the patient might choose it, because if they don't like the oil, or if the volume of oil is high, they can spray. It's kind of like a breath freshener kind of a spray. And the beauty of the spray formulation is that it coats the whole inside of the mouth and it allows the medicine to be absorbed there. So the membrane surface of the inside of your mouth is actually a great way to deliver medication. It is much faster and more efficient than swallowing it. So when you swallow medicine, it goes into your stomach, and your stomach absorbs things through something called the portal vein. The portal vein is a blood vessel that passes through your liver. So that's like the hallway on the way out of the stomach to go into the blood circulation of your whole body. It goes through the liver, and the liver's job is metabolism and breaking down things that you're trying to digest, and especially medicines. So when that medicine passes through the liver is actually taking some of that CBD out as it passes through. So when you swallow CBD, you're losing some of it to the liver if you swallow it. If you spray it and it gets absorbed inside the mouth, or if you hold the oil in the mouth and let it absorb there, like a mouthwash, or like something that you're enjoying to drink and just savoring the taste, anything that gets absorbed in the mouth goes straight into the circulation of your whole body right away. So you actually get more medicine delivered. And that's one of the nice things about the spray. The spray is currently only available in the 20-to-1 formulation. We don't have a spray yet for 3-to-1 or 1-to-1. So there is a lot to talk about in this particular slide. And unfortunately, we really wish we would know more about this. This is a difficult topic to study because historically in the United States, there have been a lot of limitations placed on research that can be done looking at cannabis plant products and particularly THC. So most of the information that we have about the effects of THC date back to 1970s, 1980s studies looking at people who were abusing cannabis as drug use and recreational drug use. So that is a hard body of data to compare to supervised medicinal use, where we know exactly what we're giving, we know what the THC content is, and we're intentionally controlling how much people are exposed to. So this is very, very different from recreational drug use, but a lot of people worry about the possibility that THC at high doses could have some negative effects. And frankly, there's a lot more work to be done here, and we're hoping to learn more about this over time, but this is certainly something that everyone needs to keep in mind when they're thinking about CBD and THC therapy. And it really comes down to risks and benefits when you look at a treatment. So most of the medications that we prescribe as doctors have positive effects and negative effects. The positive effects of THC are very clear. I see them in my practice every single day. And for some patients, those positive effects are so valuable that they're willing to take some risks. But I think it's important that people do understand that we don't have a lot of great information about exactly what that risk looks like. What dose does it take before we start to see some negative long-term effects, cognitive impact, things like that. So this is something that we hope to learn more about, but I do always caution my patients that we have limited information about this, and it's something that they should watch for and think about, and make sure that the benefits they're getting from treatment make that risk worthwhile. So this is a table that looks at these different formulations of high CBD, which we talked about before, the 20-to-1 ratio, where you have 100 milligrams per mil of CBD and low concentration 5 per milliliter of THC. There are certain kinds of conditions where we have good data that show that high CBD is the way to go. That's how you would target that. There are studies on anxiety, depression, particularly seizures. That's really the best information that we have, but also restlessness and some disruptive behavior in patients with autism. But there are lots of other things down here where the THC is more important for addressing those symptoms. And in particular, we know for sure that pain and muscle spasticity, appetite loss. One thing I would add in here that's not in, oh, I guess it is, it's because it says insomnia. I was looking for the word sleep, but insomnia and needing to sleep more is best treated with more THC and relatively less CBD. CBD is very activating. They have opposite effects in these regards. So some patients, depending on the symptoms, need more of this. Some patients need more CBD. And you can achieve that sometimes by mixing and matching the low low CBD formulations with the high CBD formulations. Some patients only take the low concentration of CBD. Some patients only take the high. Some patients use a combination of both. And this is what I do with a lot of my patients, where I added back some THC to their Epidiolex therapy for epilepsy. I'm using the balanced formulation, usually the 1-to-1 form, to give them their THC, to give them all of these nice positive effects that they were getting from the dispensary CBD that they couldn't get from Epidiolex. So this slide is just to point out that we have a lot more to learn about this therapy. And all of these questions are questions that I am looking forward to learning more about over time, so that we can really understand how to do this well. I feel like I've learned a lot about this in the last 2 years since I've been prescribing this medication, but we have lots more to learn, and especially on from the standpoint of bigger studies with good scientific controls, lots more to learn in years to come. So a few other important topics that I want to touch on briefly. One of the challenges that we run into is when patients are in school during the day, or if they get admitted to the hospital, again, because this is not a federally approved substance, but it's a Texas legalized substance. When patients are in the hospital or going to school, the staff is often not allowed to administer this, and there are lots of rules about it, and people in the hospital and at school can get very nervous about how to give this medication. Fortunately, here in town, the two hospitals that I work with children at St. David's, North Austin, as well as at Dell Medical Center, they have been very open to working with us to make sure that the patients can still get this medication. It's administered by caregivers in the hospital setting, but it is not part of what the nursing staff administers. School nurses still generally are not able to give this medicine during the day, and most home health care nurses are not administering it. The families and caregivers are still administering it. Let's talk a little bit about terpenes. So terpenes are chemicals that are also found in the cannabis plant. So the cannabis plant that I showed you in the picture at the beginning from the dispensary that they're growing contains these chemicals. And terpenes are very fragrant chemicals. When you walk into the dispensary and you smell those plants that are growing in the back part of the building, you are smelling the terpenes. You're not smelling the CBD and the THC. You're smelling these chemicals. So in the original formulation of the product that we made at Compassionate Cultivation, the pure product, all of the terpenes were removed. We wanted to have a very pure product initially and be sure that we really understood what the CBD therapy would be like with no terpenes at all. However, and as many patients remind us, and as you will see all over the internet and lots of different publications in different scientific journals, etc., there is a lot of thought about the fact that these chemicals that come from the cannabis plant, these terpenes, would also have some medical benefits. So there are a lot of people who think that CBD treatment is even better if you mix in terpenes. So after Compassionate Cultivation had been making medicine for a while, they decided to make a second form of treatment, second form of medication that had terpenes mixed back in. So when they distill the medicine product out of the plants, first they remove the CBD and THC chemicals and they get that mixed up into the oil just the right way. And then they actually take the terpene component of the chemicals and mix that back in. And because all of the plants that grow in the dispensary come from the same basically set of twins, they are what we call clones. That means that their terpene profile is very consistent. And the terpenes that are mixed into the plus formulations are always the same from one bottle to the next. And so you can actually get CBD and THC therapy from the dispensary that has terpenes mixed in. So the term that is used, and if you read about medical cannabis, you'll see this term used, is the entourage effect. And the entourage effect means that the impact of these chemicals together is actually more powerful than the CBD and THC alone, that they are kind of cooperatively working what we call synergistically to give more benefit. Now, the entourage effect from a scientific standpoint has not been studied very well. We don't have really good proof to know that it's true, but we have a lot of patients who are very convinced that this has made a big difference in their therapy. And it is an option that you can discuss with your prescribing physician if you're interested in trying something with terpenes. I'm going to talk a little bit about over-the-counter CBD. So in the past year, because of changes on the national level with the Farm Bill, there has been an explosion of over-the-counter CBD. And as most of you know, you can buy this at nutritional stores, pharmacies, supermarkets, the local state fair, even your corner gas station sells over-the-counter CBD. So you can also get it from the internet. But those products are different from what is sold through the dispensary because they are very, very limited in THC content, and they can only be produced from a subtype of the cannabis plant that's called hemp. And hemp is defined as having a very low content of THC. If the THC content gets too high, it's not called hemp anymore. It's a typical cannabis plant. Because the concentration is so low in hemp, you have to extract medicine from acres and acres of plant in order to get product that will fill the medicine bottle. So usually the over-the-counter CBD that is sold, even from very famous companies, has a very low content of CBD. So compared to the 20-to-1 formulation at the top, where there's a 5% THC versus 100 milligrams per milliliter of CBD, It's often more, less than half as much CBD, sometimes very, very little CBD in it. And then likewise, the THC is much, much lower, sometimes barely measurable. In addition to that, it can be very inconsistent from one bottle to the next. So the next time that you get a refill, there might not be very much there at all. And it can be different every time that you fill the bottle. So just a few words about how to bring this up with your physician. This is a medicine that I would encourage you always to be exploring with a physician. I think when the compassionate use program first started, a lot of patients were shy about bringing this up to me. Sometimes that took me by surprise because I think most of my patients knew that I was pretty open to CBD therapy, and it's gotten easier to talk about it. But a lot of physicians are still pretty nervous about the whole thing. They may not be as knowledgeable sometimes as the patients who bring it up. So it can be a little bit difficult. So the more you feel comfortable with understanding what you're asking for, the easier that conversation will be. You definitely want to share with your physician if you are interested in it, or if you have explored it a little bit with any over-the-counter or internet products, because we want to be sure that you're able to get access to good quality medication through the dispensary, and hopefully your prescribing physician can lead you to someone who is working with the compassionate use registry so that you can get a prescription. So if you go to the website for Compassionate Cultivation, there are many more testimonials of patients that have done really well. Patients with autism, other kinds of neurologic diseases, and lots of patients with epilepsy who have had a really life-changing experiences with these therapies. And I really recommend the website to you as a very useful resource. We have posted lots of different kinds of articles on lots of topics that I think both patients and families as well as prescribers can learn from. I think that's my last slide. I'm going to go back to full screen here and be open to answering questions. I think that I've seen a few questions coming through.
Great. Thank you, Dr. Keough. I can go ahead and help facilitate these questions for you. We appreciate everyone tuning in, and if you do not have a question that gets answered, please visit us at our website and you can contact us there. Dr. Keough, one of the questions we received was, does medical cannabis interact with any other anti-seizure medications, specifically Sabril or Keppra? And if it also interacts with any benzodiazepines such as clozapam.
Okay, so the question was about medical interactions. This is sometimes a hard question to answer because we don't have information about all kinds of medicines that are out there. Fortunately, because of the studies that have been done in epilepsy, we have more information about interactions with epilepsy medicines. And we know a fair bit about it, but we don't know about all of the medicines out there. But there are a number of published studies on this. Most drugs in most seizure medications do not interact very much with CBD, which is very fortunate. There are a couple of exceptions to that rule. There is one specific kind of benzodiazepine, which is a class of epilepsy drugs that includes things like Valium or Ativan or Versed. There's one in that group that's called clobazam. It's also called Sympazan or Onfi. It's actually a very commonly prescribed seizure medication, especially in children. And it was studied a lot because the epilepsy that we talked about before, Lennox-Gastaut syndrome, is very commonly treated with Onfi. So Onfi is digested in the liver by the same enzyme that digests CBD. And because of that, the liver enzymes get kind of tied up and busy if you give CBD at the same time, and it slows down your ability to digest Onfi out of your system. And the result of that is that the level of Onfi in your system actually goes up. So if you were taking 20 milligrams a day, without changing that dose of Onfi, if you add CBD in, your circulating level of Onfi or clobazam is actually going to go higher, and it'll kind of level out at a steady state. If the CBD dose is consistent and steady, then the Onfi level will be steady too, but it'll be higher. Now, sometimes that's a good thing. It can actually contribute to better seizure control. And in the studies of Epidiolex, where we really saw this the most clearly demonstrated, the group of patients who were taking clobazam and CBD together did better than the group of patients who had other kinds of medicines mixed in with their CBD therapy. So they are good partners. It's a good marriage, but you have to know how to use those medications together. And you have to know that when you add CBD, the OMFI is going to go up. And the first thing that you're going to see is that the patient will get more sleepy as a result of that. So the seizures might improve, but if you're sleeping all day long, that's probably not a good trade. So you have to usually readjust either the dose of the CBD or the dose of clobazam to make that better. There are other medicines that we know do not have interactions. The question asked about Keppra, which is levetiracetam. That medicine is not digested in the liver. It goes through the kidneys to get metabolized out of your body. And so there's no interaction with that medicine. There's then the other question was Sabril, which is vigabatrin. Vigabatrin is not as well studied because it is not something that was widely used in the Lennox Gastaut trial. We don't have a great deal of information about those interactions, but as looking at the metabolic pathway, it's not thought to interact very much. There are a few other medicines that do metabolize in that pathway. Zonisamide and topiramate are two other medicines that do metabolize in the same pathway. There's a little interaction there, but not as dramatic as the clobazam. The other interaction that we know about is a medicine called Depakote, which is also called valproic acid. And valproic acid doesn't compete with the CBD for liver enzymes. It's not a metabolic interaction or a digestion issue like that. It's more of the likelihood of developing side effects. So one of the things we watch for with CBD therapy is the enzymes in the liver actually can go higher. You do a blood test and you can see that the liver enzyme levels go up in some patients, and that's not a normal thing. They'll go up outside the normal range. Now, there have been 0 patients doing CBD therapy that have developed a problem with how the liver works. Nobody who's had problems with blood clotting, for example, or developed jaundice from it, or other kinds of more serious reactions. It's just something that we see in blood tests. And we know that happens in some patients with CBD, and it can happen with CBD by itself. It can happen with CBD and several other medicines, but with CBD and Depakote together, more patients had higher liver enzymes. There were still no people with bad liver problems, but there were patients who had that more commonly. I do watch liver enzymes when I prescribe this medication. I have never stopped it because of abnormal liver enzymes. I actually have not seen very significant liver enzyme elevation, even though I'm watching it in all of my patients and I look at it repeatedly. I've seen some patients go up a little bit, but never to a degree that's concerning. So it hasn't had a lot of what we call clinical relevance. It hasn't changed my treatment most of the time, but I do watch for that.
Great, thanks, Dr. Keough. Another question that we received from Debbie is, she actually says, we found that it works best to dose cannabis 2 hours before Lamictal. Do you have any other patients who have found they need spacing between meds?
So I'm just going to repeat the question, make sure everybody heard it. So I hear Sam talking in the next room, but she's not coming through my computer video. So I'm going to repeat it, make sure everybody heard it. The question was that this is a patient that has found that dosing it separately from other medications 2 hours apart has provided better results for them and their family and for the patient in that family. This is something that you will commonly see written in the internet. A lot of patients ask me about this because it is advice that they will find in other places. I actually don't tell my patients to do that because it turns out to be pretty complicated to do that. A lot of my patients take many medications and they are taking medicines already 2 or 3 times a day. So if you're spacing it out and you're doing it 2 hours apart from every other medicine, they might be taking medicine 6 times a day. That's hard to do. And from my experience with treating lots of patients, I think it's likely that most patients don't need that because I have lots of patients who get good results without doing that. But I have some patients who have chosen to do that. And it may be that for some patients, it could make a difference. I'm not saying that I know that it doesn't. It's not really something that's been studied, and it is on the internet a lot. So I think people see that and they try to take that to heart and do it. But if you're doing 1 or 2 medicines once or twice a day, that might be feasible. I think that it may not be worth the extra effort to do that a lot of the time.
Great. Is there another question? Alicia asked, is there any difference in the effects if taken by a G tube?
Okay, that's a great question. How to take this medicine if you're administering it through a G tube. That is something that a lot of my patients do. A lot of my patients do receive either medicines or food through a G tube, and a lot of them cannot take medicines safely in the mouth. They can't take advantage of that oral absorption like we talked about before because they have a risk of breathing into the lungs if they get medicine in the mouth too much. So you have to do it through the G tube. The problems that I have seen, it's a little bit tricky because the oil is very thick and the oil sometimes can interact with the plastic of the G tube. So if the oil is sitting in the tube itself for a long time, it can cause some breakdown, and sometimes it just, changes color and becomes a little bit opaque. But I've had some patients say that it actually made their tube malfunction if they left the oil behind. So they have to be sure to flush it through very well. But what I usually advise my patients to do is to take the oil, if they're giving it through a tube, and mix it with a small amount of just formula that they would normally use for feeding, and administer it not by itself as oil, but as formula and oil mixed together in whatever volume makes sense for administering it. So if you're giving a 10 milliliter dose, you might need to add 20 milliliters of formula. If you're only giving a 1 or 2 milliliter dose, you might add 5 or 6 milliliters of formula. But that way it's not just solid oil going through the tube and then chase it with a little bit of oil. The other advantage to administering the medicine that way is that because this medicine, the reason that the medicine is made and suspended in oil is because it actually dissolves in the oil, and it would not dissolve in water or other kinds of solutes. So it has to be suspended in oil. And because it is what we call lipophilic, it loves the oil and dissolves in that, you absorb it better if your stomach is absorbing food in general. So it's good to take this medicine with a little bit of food and have a little food in the stomach at the time. And that makes it a good way to administer through the G tube with a little formula mixed in.
Okay, that's great. That leads us to another question, actually, about the food it's taking or dietary differences in itself. Do any foods interact with the CBD medication?
I don't know of any food interactions. I do treat some patients that are on special diets because of their epilepsy. The most common is either a modified Atkins diet or a ketogenic diet. And these are diets that are very high in fat and very low in carbs, which makes a medicine that's made from oil a really good thing to use as a medicine because we don't have to worry about extra carbs. So that works out fine, and you don't have to do anything differently with the with your diet if you're using CBD therapy.
Great. One question from UT is, how can students at specifically UT Austin get involved in research efforts to help find answers to some of these questions, or is there any ability for that?
That is a great question. We would love to have some students get involved in the research that we're doing. So at CNCA, we have a couple of research projects that we're working on. Please reach out to me if you're interested in participating in that. We are doing observational follow-up of the patients that we're treating. We are hoping to start an observational follow-up study on patients with autism soon. So we would love to have some student involvement.
Great. Well, another question that's become relevant is trying to get a longer prescription. So some physicians are only prescribing a 30-day supply due to, I guess, what they're stating is regulations, and they've asked for a 90-day supply, but it's a controlled substance and the physician can only prescribe 30 days at a time. Is there any other way they can go about getting a longer prescription?
So that's a little bit of a tricky question. I'm pretty familiar with the statute. As far as I know, there is no limitation in the statute that says there's a maximum amount that can be prescribed. I think that is something that a physician's level of comfort determines. There are rules in place for other kinds of federally controlled substances that do limit how much you can prescribe, but that's not directly relevant to the Texas Compassionate Use Registry program. The registry is kind of tricky because it does not allow us to delineate refills. So if you put in a 30-day supply, that's all that you can put in. If you put in a 60-day supply, that's all that you can put in. And you can only put in as many days as you enter into the prescription, and you can't designate the way I do in other kinds of prescriptions and say, okay, 2 refills just like that when that one runs out. So I actually do the opposite, and I will routinely enter a 90-day supply, and then the patients can fill all 90 days if they want to, or they can kind of withdraw like they would from a bank account and take 30 days and then come back 30 days later and take another 30 days and then come back and fill it that way. And it is legitimate to do it that way, but I think it's really the prescriber's discretion as to what they are comfortable doing. So I think that's something to take back to your prescriber and have another conversation to better understand where that limitation is coming from.
That's great. Another question we have is, it says, CBD oil currently approved for use for treatment of autism spectrum disorder? And if so, have you seen it being prescribed for behavior usage?
So yes, in the expansion of the Compassionate Use Program last June in Texas, it did include autism. And that was a very big milestone for us. So I have a lot of patients who have autism and epilepsy together. So I had already been using it in patients who had both. And I was definitely seeing very significant changes in behavior, beneficial effects on behavior in a lot of those patients. Calming effects, less aggression, less self-stimulation, improvement in sleep, lots of different things. And different patients respond differently. Treatment of behavioral symptoms is often pretty tricky and very individualized, but I've definitely seen those benefits. So when it expanded to include autism, it is definitely something that we are doing within my group at CNCA. Again, most of my patients for the most part, I'm only seeing epilepsy patients. I don't have patients who have exclusively autism. So the patients I treat with autism have both, but I have a number of partners at CNCA who are seeing autism patients and are prescribing CBD for their behavioral symptoms. And the degree of response can vary, but it can be extremely beneficial. So I definitely encourage people to explore that if it's something they're interested in doing. It is absolutely now part of the Compassionate Use Program in Texas.
Great. Another question that we got is from someone who is currently using another, we won't name it, but it's another CBD source. It's not a medical cannabis source. They claim to use whole plant, full spectrum, and they've done really well on it. She's considered moving over to our Lone Star CBD, but the question is if it's working for her, should she change? They're just reluctant to change to something.
Yeah, I also talk about this a lot with patients because it's not unusual for patients to come and see me and they might already be using CBD from other sources. So there are a number of advantages to switching to the Texas dispensary program through Compassionate Cultivation. And the main reason that I emphasize this for patients is because I have such strong confidence in the quality of the product that they're getting from Compassionate Cultivation. I am absolutely certain that every bottle has exactly what it says on the label. I know what it is. I know how to supervise that use. And when I have patients coming to me who are using CBD from other sources, I don't know how much I can rely on the consistency of that or even that the labeling is accurate. So there have been studies that looked at internet sourced CBD and even from some pretty big names. And oftentimes the label is not what's in the bottle. And sometimes there's actually no detectable medication in the bottle. So sometimes people are paying for something they think is an effective medication and they aren't getting what they're paying for. Now, if you have a patient who is getting a good benefit from what they're using, I still encourage them always to switch to Compassionate Cultivation, again, because I have confidence in what I'm prescribing if I'm getting the medicine through the dispensary and my patient is getting the medicine there. And then I can stand behind it and know that when I'm prescribing and guiding that therapy, they're going to be getting what I think they're getting and nothing else. So I have every confidence that if they're getting good benefit from somewhere else, I will be able to match that or make it better with medicine from Compassionate Cultivation. And that's why I encourage people to switch.
Great, thanks for answering that. To switch gears, we have a question from a physician. She wanted to ask, what is needed from a legal standpoint to prescribe for diagnoses like cancer or epilepsy? does the physician need to have documented as evidence of the disease in order to prescribe? Example, for epilepsy, do you need an EEG? Do the she need to see the records, or how does that work?
Yeah, so that's a great question. The statute itself actually does not address that question specifically. So you're not breaking the law in terms of insufficient evidence. But I think the best way to answer that as a physician is for me to say that you would want to be able to document whatever you would document to use any other treatment for that patient. When you're making a diagnosis, you want to have adequate, to your own satisfaction as a prescribing physician, adequate evidence that supports that patient's diagnosis. So sometimes patients come to me and they've already had a diagnosis made of epilepsy. And if they come and they have previously been diagnosed, I always want to see prior records anyway. I'm going to rely on that to guide treatment on lots of different levels. Sometimes I repeat studies. Sometimes I order a new EEG. Sometimes I don't. If I have a report from an EEG that someone else has read and I have confidence in that, then I don't necessarily feel that I need to repeat studies that have already been done. But I do insist that I have verifiable evidence of prior tests. And if I don't have verifiable evidence from old records, then I do repeat the tests always. Do standard evaluation that are appropriate for a diagnosis of epilepsy, and that would usually include an EEG of some type, short or long, and it would usually include some neuroimaging, usually an MRI scan, if that's not been done. Most of my patients already come with those studies in hand. They're not usually difficult to obtain, and if I can't obtain them, then I get new studies and update them.
Awesome. What are your thoughts on the Texas legislature and if they're going to increase the allowable concentration of THC during the next session?
So that is something that's an active topic of conversation amongst us here at the dispensary. We are hopeful to be able to get some more flexibility and be able to give higher doses, higher concentrations of THC. From the standpoint of treating, I think that the main advantage of being able to administer higher concentrations is being able to give more medication without so much volume. So I have a lot of patients who drink a lot of oil to get their medicine because that's how much it takes to deliver the THC that they need. And that can cause some side effects. So just from a standpoint of making the therapy as tolerable and as free of side effects as we want, that would be great to have that flexibility. In point of fact, having limitations to a low concentration does not necessarily mean that people don't take higher doses of THC. They just have to take more medication to get it there. So I think, I hope that the legislators will understand that this is really why we have prescribers involved, because we want our prescribers to be in charge of making those healthcare decisions. How much does this patient need to be taking, and how do I best deliver that to them? And so having more flexibility in formulation and having the ability to make slightly higher concentrations would be great. Certainly it would not be our goal to have super extremely high concentrations, because you don't actually need for it to be super high, because we're not looking for a euphoric effect, we're looking for a medicinal effect. And even patients who take pretty high doses don't need to be taking hundreds of milligrams a day, but some flexibility would be really helpful.
Awesome. Another question we had, and I know we're kind of cutting it on time, would be someone was asking if there has been any epilepsy patients that you've seen that had better results with the plus, meaning the with terpenes.
So I have not had a lot of my patients switch to plus. I have a few that take plus by their own choice, and I'm always okay with that if they want to try the plus. I have yet to have a patient that it made a difference to switch to the plus for them. But I'll tell you that most of my patients aren't using the plus, so I don't really have enough experience with a lot of patients making that switch to be able to say, yeah, that happens. It might happen. I am not necessarily convinced that it won't happen. I just don't know that it does. And the science and the evidence that I use for my practice has come from pure CBD studies, not looking at terpene therapies and whole plants and things like that. I think that when you start talking about a lot of different chemicals in the mix, I get nervous about the possibility that those chemicals could bring negative things to the table and not just positive things to the table. And I much prefer personally to prescribe the pure CBD. But as I said, if a patient is looking for the plus formulation, I don't tell them that they shouldn't.
Great. Another question is, are there any detrimental effects in high THC usage, or does your body wash it out once those receptors are filled?
So in very high doses THC usage, you would definitely get a euphoric effect at some point. How much that would take would depend on the size of the patient, what other medicines they're taking, how much their system is accustomed to THC exposure. Lots of different factors affect that. How efficiently they're absorbing the medication and how it's delivered. It can be difficult to predict, but absolutely higher doses would result in not just euphoric effects, but then potentially some cognitive impact at some point. I would be worried about important things like ability to drive and focus and concentrate and do jobs and things like that at very high doses. I don't have any patients that are using doses that high because I'm always mindful of making sure that we keep the total THC dose in a day relatively lower. But at high doses, yeah, it could cause some detrimental effects.
Okay, great. And I think our last question that we'll take is regarding, someone wanted us to discuss the cost difference in 20 to 1 to 1 to 1. The difference, obviously, the amount of medication in the bottles.
Okay. So there is a big cost difference. And if you think about it, just in terms of how much medication is in the bottle, that's where the cost differential comes in. So the CBD that's in a bottle of CBD, if you have a 30 milliliter bottle, which is an ounce, you have 100 milligrams per milliliter of CBD, which means you have 3,000 milligrams of CBD. If you have a 1-to-1 bottle, you have 5 milligrams per milliliter of CBD. So instead of 3,000, you have 150 milligrams. So it's a very much more dilute formulation. The amount of total THC milligrams is the same in both bottles. So the differentiation is how much CBD you're actually buying, and that's why it's less expensive. So the amount of plant product that you would have to distill to get 3,000 milligrams of CBD is a lot more plant. And that's why it costs more to make that. And that's why the cost is different. So to get 150 milligrams, it's a lot less plant. The THC is the same in both bottles.
Great. Dr. Keough, thank you again. We'll go ahead and end this here. We will be doing another follow-up in about 2 weeks.
Yeah, the next time that we come back, we're going to be talking about autism again. I am working with some of my partners to see if I can get a few other people to chime in and have more of a group discussion the next time around. So stay tuned, and I hope to see some of you back and think up some more questions, because we're happy to talk with you more about this really important topic. Take care and stay safe.